So I'd like to begin just by outlining some of the key concerns of the disability community and then move on to a brief discussion around intellectual disabilities particularly. So I think the concerns of the disability community are well known. Recently in the debate around Bill C7 in the federal parliament, over 140 disability organizations from across the country signed a letter expressing their concern around the introduction of C7. And this concern was shared formerly by the UN Special Rapporteur on the Rights of People with Disabilities, Devandas Aguilar, who after her visit to Canada was extremely concerned about the implications of assisted dying legislation on people with disabilities after hearing multiple complaints. And she urged the federal government to investigate these complaints and put into place adequate safeguards to ensure that persons with disabilities do not request assisted dying simply because of the absence of community-based alternatives. This was echoed by her successor, Gerard Quinn, in the hearings on C7, and he was joined in his concern with the independent expert on the enjoyment of human rights by older persons and the special rapporteur on extreme poverty and human rights. So I think the concerns are very real and shared by others. And it is, for me, it's difficult to imagine a piece of legislation passing that was so universally opposed by the group, by an equity-seeking group, and by so many UN experts on human rights. And I think that really highlighted the frustration of the disability community in terms of having their voices heard and taken seriously in the debate on medical assistance in dying. So I'm going to outline some of the key concerns. The main concern is really this issue of MAID as a substitute for acceptable disability supports. And unfortunately, we've had a number of cases now that have gone public. Archie Roland, who died by MAID, was cited in the Montreal Gazette that it's not the illness that's killing him. He's tired of fighting for compassionate care. Monsieur Touchon, in fact, the plaintiff in the recent Quebec case at a news conference, had his assistant read a statement that he couldn't face the prospect of a life confined to institution. So clearly his motivation to seek the right to access MAID was a social one as much as inherent to his disability. 41-year-old Sean Taggart, a man who lived on Vancouver Island who died by MAID. He was very clear that he chose MAID because he was unable to secure sufficient home care hours to allow him to remain in his home where he could be with his young son, and the alternative of moving to an institution was unacceptable to him. And finally, in Quebec, Jonathan Marchand, in his protesting for additional care, he set out quite eloquently in his testimony to the Senate, "I was prepared to do anything to get out of this medical hell, but just like Jean Touchon, I was denied home care support that I needed. After 2.5 years in hospital, I ended up in a long-term care facility. I gave up and sank into depression. I was ashamed to live in this ghetto. Without humanity and freedom, life no longer has any meaning. I regretted having refused euthanasia. I simply wanted to live with my partner, work, and have a normal social life. My disability is not the cause of my suffering, but rather the lack of adequate support, accessibility, and the discrimination I endure every day. Why is it so hard to be seen and heard when we want to live?" So I think it's fairly clear why some people with disabilities are seeking aid, and it's really a structural problem in terms of being able to access the kind of supports they require. Currently, there are over 18,000 people in Quebec between the ages of 18 and 64 living in healthcare and related facilities, and some 5,000 in nursing homes, seniors facilities, including 1,325 under the age of 50. In the field, in much of my work involves designing and setting up and advising on disability support systems. And the gold standard now is for people to have as much control over those supports through things like direct funding and home-based supports. And really, we know now that there is no level of disability that we can't accommodate within an adapted home environment within the community. So the reason younger people are being institutionalized is not due to their disability, but due to structural and policy and financial constraints. Add to this that disabled people are one of the most marginalized in the country. Roughly 29% of working age adults with disabilities are living in poverty, and suicide and suicidal ideation are strongly correlated with economic deprivation. Add to this, they are far more likely to be victims of violence than Canadians without disabilities, particularly women and those with mental health disabilities. Poor access to appropriate housing and high rates of institutionalization and poor access to disability supports add to this general picture that being disabled in Canada is not one conducive to living a full and meaningful life. Due to the absence of full supports, many people are dependent on their family or their caregivers. And we know from both the Canadian data and data from other jurisdictions that feelings of burdensomeness are a key driver for people to seek access to medical assistance in dying. So the risk of opting for MAID rather than continuing to struggle against many of the barriers disabled people face in trying to live a meaningful and fulfilling life is not one that can be lightly dismissed. This risk is arguably heightened in the context of austerity and concern with rising health and social care costs. In their submission to the UN Human Rights Commission, the major Canadian disability rights organizations note that under Article 16 has recognized the rights of persons with disabilities to effective enjoyment of the right to life on an equal basis with others. States are required to provide measures of protection to guarantee this right, including the provision of reasonable accommodation when necessary to ensure the right to life, such as ensuring access of persons to essential facilities and services. And I think it's fair to say Canada is somewhat behind in meeting its expectation on the Convention on the Rights of Persons with Disabilities.